Hey everyone, how are you? Thank you for tuning in today. We have a very awesome presentation for you and something I hope sparked your interest. We've got a slideshow, and then we have a live demo, and we've got some really fantastic promos. So let's get started with the slideshow. And thank you, by the way, for everyone for tuning in. I really appreciate it. Okay, so today we're going to talk about cellulite treatment and body contouring. Look at that cute little baby's butt over there. So even babies have cellulite, and we'll talk more about how it's a hereditary component. So you know that I am very passionate about cutting edge technology in cosmetic dermatology, and we're always looking for new, fun, safe, effective ways to bring you the latest and greatest treatments. So cellulite treatment and body contouring is one of the areas that we're seeing a lot of growth in right now, and we're having some really awesome results. So I thought I'd share some information with you, and we're going to be seeing more of this to come in the future. So why come here for your treatment? Because as you know, I love cosmetics. I love all dermatology, but I love cosmetic dermatology, starting from when I was a resident and ongoing when I did my cosmetic fellowship. So I've been doing this for a long time. I'm very active in doing studies, and I've done studies specifically on cellulite, and I've even served on some advisory boards for companies who are developing new cellulite treatments. So it's a really exciting, cutting-edge field, and I feel like I'm very knowledgeable about it. Of course, we always encourage you to choose a board-certified dermatologist who has experience with these procedures. Next slide. And I want you to know these are off-label indications for these products, meaning the companies thus far have not done a study to get FDA approval for these indications. All right, so when I'm doing cosmetic consultation, or even when I'm doing a skin check, doing general dermatology, a lot of times patients say, how can I get rid of the cellulite? What do I do about this crepey skin? And there are some things we can do, some things that, we just have to live with thus far. But there's some products such as Sculptra, Radiesse, and threads, PDO, specifically PDO threads, that can really improve cellulite and really help to treat that crepey skin. And these are minimally invasive treatments, by the way, so these are not surgical treatments. So you probably know what cellulite is, but it's that orange peel flesh, and it's common around the midsection, the thighs, the hips, the buttock, the abdomen. You can even see it through, a lot of times, yoga pants, and a lot of my patients are telling me they feel self-conscious when they're wearing shorts. And then there's crepey skin. And crepey skin is sagging skin that's caused by loss of collagen as we age. So we lose some of the structure underneath. And by the way, forearms, I think, are the most commonly asked about body part when I'm doing general dermatology. So we lose structure under here, and it results in loose skin, which we call crepey, and it drives us crazy. So here are some photos, and these are photos, just stock photos taken from the internet of crepey skin. The two photos on the left are an example of crepey skin, and of course the photo on the right is an example of cellulite. So we'll start by talking about the two products that I inject to treat crepey skin and cellulite. So I use Sculptra and I use Radiesse, and I use it a little bit differently than how I use it on the face. So there's a special mixing technique that we use and a special injecting technique that we'll use, and you'll see that more in person later. But the point is, it's good to go to someone who's had experience with this, and again, just knows the proper way to do this, and that we'll get safe and effective treatments. So, in a nutshell, Radius is going to give you more of an instant result. Sculptra takes a while to go into effect, but it's going to last longer. So in our model today, I'm going to use Sculptra just in the interest of time. But commonly during treatments, especially around the buttocks, I will use a combination of these two. And the Radius, because it is a filler as well, it will be more instant gratification, which of course when we're making a significant time and monetary investment, we want to see something right away. So using the two together tends to give me a really nice result, and a great emotional result too, because like I said, you see the result right away, but it's just going to get better over time. All right, so when I treat cellulite, I inject the products into the little dimples and around the area dimpling. So we want to smooth out the dimples, but we also want to increase or improve the overall texture. And so the resulting collagen stimulation will be really, really smoothing for the area we're treating. And so when treating cellulite, we focus a little bit more on the texture and target the dimples. And when treating crepey and sagging skin, we're focusing on building a little bit more volume. And often, to be honest, I do the two together. And so this is an art, and we combine techniques to give the best result. And you'll see an example of this later. So we can use these products almost anywhere on the body. We've got to have nice, healthy skin to begin with. So typically I mentioned earlier that everyone asked me about the forearms. I don't typically do the forearms because the skin there is so thin. But we can do the arms and like the tricep area. We can do the thighs above the knees. That's my problem area. We can do the neck. I have a lot of interest in neck and chest. And of course, we can do the buttock and upper thigh area. So just a little bit about Sculptra. It's an injectable. It stimulates collagen. It's been FDA approved for almost 2 decades, over a decade. So it's very safe. The results do take up to 6 months to see the full results, but they can last 2.5 years. And sometimes even longer. So I love this product, and a lot of you know that. The next, and here's an example of lifting of the face that we can achieve. And some of these photos are a little bit older, so this is kind of fun for me to see. But you can see left is before, right is after, and we get some nice, natural looking lifting of this patient's face. Same thing here. This is an example of crepey skin. So you can see that the crepiness is improved after Sculptra injection. And here we get skin tightening, we get improvement of the crepey skin. You can see this is a very old photo, but I've been using this product for a long time. I still love it. All right, and then the next product is Radius. It's a filler, and so it has calcium hydroxyapatite. That's the main ingredient, but it's also thought to stimulate collagen. So it's a really great sort of hybrid for giving us those results, but also giving us long-term improvement. All right, here's some just examples quickly. So jawline, this is just an example of jawline definition in a younger patient. And then this is an example of more of a full face rejuvenation. So adding some volume, improving the crepiness in this patient's face. And then again, a younger patient. So we did some jawline contouring, and we did some in her chin as well. And then here's an example off the face. This is an example of the neck. And you can see not only improvement of the lines, but the overall skin texture is improved by just injection of Radius. No laser, I don't believe any Botox as well, although both of those can be used. Here's just a pictorial schematic. So it's not super scary. It's just like getting a cosmetic injection. Here's Dr. Pearson treating my problem area, one of my problem areas, the area right above my knee, where I just want to see tighter skin. I want that crepey skin to go away. I love these treatments. I'm a huge believer in them. All right, so this is where we're going to be doing our demo, and we can treat the buttock area. It does require a little bit more product, but because it's a bigger area, but you can see the beautiful lift we get from this from these products. So I just want to mention really briefly that not only we can do these products, but we have a device that will contract the muscle, like going to the gym. And I have seen results where patients want a better booty. We improve it with some injectables, and then we put them on this cool tone device, and a device that can contract the buttock muscles. And it is amazing at the lift and the shape change that we can get. It's really awesome. So next slide, please. Okay, so how much will we need? So we're going to allow, it depends where we're treating. So for instance, tricep area, it's not going to need as much. You know, a lot of times I'll start with 1 vial per side of the Sculptra, and then you can see how it's looking. We add a little bit of radius to top it off. Like I said, this is an art. But just to give you sort of like an overall idea of what we're looking at, 2 to 6 vials of Sculptra, 1 to 2 syringes of radius per area. So for instance, again, tricep area, you're going to be on the lower end of that. Abdomen, depending on how much loose skin there is. I've also had my abdomen treated, by the way, and it worked amazingly for my loose skin from having 3 kids. And then for the buttocks, of course, we're going to be looking at a little bit more product. I would say average is between 6 and 12 based on our goals. But again, it depends if we're going to use radius, and it depends if we're going to use threads as well. So just very briefly, I often use PDO threads to help with our results, to help augment our results. So threads are like little tiny, it looks like fishing line a lot of times, and some of them have little barbs on it to give us support and structure. So threads can treat both of these areas. It can cause lifting, the barbed ones cause lifting, and the smooth ones improve the texture of our skin. And again, here's where the art comes in. A lot of times I will use Sculptra, radius, threads, and each person has a different recipe that we're using to maximize results. So again, they're very easy to use, topical numbing. Next slide, please. Some before and afters of the face. One side is treating, one side is not treated there. A picture of someone's neck. We got some skin tightening after using the threads. And again, the threads, not perfect, but this is threads only here in this particular patient. So pretty cool to see what one treatment of threading can do. Okay, this is after 1 threading treatment. You look at her jawline, it's much smoother. Look at her cheeks, she looks more contoured. Again, a single treatment. Look at her jawline. Look at around her lips, it's a lot smoother. And then of course her cheeks are lifted and more contoured. All right, so we're going to pause here to say that everyone who has attended today gets this really awesome raffle. So we are going to be giving away 2 syringes of Radius, 1 syringe of Bellatero, and 20 units of Xeomin. What is all this stuff? We don't have to use it on the body. We can use it in your face, but you can have a cosmetic consultation with me and we can talk more about it. Excuse me. But these are products that I don't care who you are, you can benefit from these products. These are universal for almost everyone. Okay, so this is our special for this event. So again, with just keeping in mind that usually this is a little bit more than it takes for the face. The face is a small area, body's a bigger area. Keeping in mind that it takes a little bit more product, we put together this promo for you to try to encourage you to make this investment in yourself. If you purchase 6 vials of Sculptra, you will receive 1 syringe of KISS, which is hyaluronic acid, FDA approved to treat the lips. Off-label, we can also treat other areas of the face, marionettes, nasolabial folds, cheeks, that's all off-label, but it's got many uses. And so that is a really great deal because it's valued at $675 for the Radiesse. Buy 2 syringes of Radiesse, you save $200. Buy 3 syringes, you save $375. We are trying to get you closer to your goal of investing in yourself. We're going to give you until Friday, August 28th. But I really encourage you, if you've been wanting to do this for a while, jump on this offer, take advantage of it because this is a great deal. Okay, so you can call the office, email the office. Here's an email address for you. There's our phone number. And again, this is highly individualized. So we need to talk before we treat. We can do talking and treatment the same day, but I am going to sit down and listen to you and listen to what you want. And then we're going to go from there. So we are ready for our demo. Again, thank you all so much for tuning in. I am going to pause for a moment while we reposition the camera. I'm going to get my mask and my face shield on, and then I am going to do marking of our model, and then I'm going to do some injecting of our model as well. So pause for 1 second, and we'll be right back. And I'll just grab cord. Okay, everyone, hello. Thank you for hanging in there. So this is our model, and we have previously had our consultation. We are going to go after 2 things. Number 1, she's a little bit asymmetrical. Number 2, you can see she's quite thin. We're going to try to round her booty a little bit. And like all of us, we want to try to lift the booty a little bit. So, Heather, maybe you want to get a little closer while I'm marking. So I'm going to do the marking first, and then, like I said, we'll do some injecting. Okay. So I've already looked at her, and we actually earlier did some preliminary markings, and I had our model look in the mirror and make sure she agreed with them. And I am going to remark her. She's already been cleaned, prepped, and I'm going to remark her so you can kind of see the philosophy of what goes behind the marking. All right, so, and then maybe just even a little bit closer so we can see the contour and the shape just a little bit. We're trying to get you a little closer so you can see this model's individual asymmetries and the areas we want to work on. So for this model, she's asymmetric. This side, I have a theory that she's stronger in this glute, and it makes this side over here a little more sunken in. If I inject Sculptra and Radiesse in this area and strengthen it with threads, it is going to make it more symmetrical. It's going to fill in a little bit of hollowing there, so she's going to be rounder here. And then it's also going to prevent sagging. It's going to pull up because there'll be more volume here. It's going to prevent sagging, prevent the thigh skin from coming down, which is often what causes our thighs to look like we have cellulite. It's often the gravity from not having enough structure for the skin to sit up here. So when we lose volume here, the skin comes down and it makes the skin down here look crepey, and it makes it actually look like it's cellulite, but all you have to do is raise it back up here. So for this model, I am going to mark the side that is a little bit more atrophic or sunken in. And then, yeah, I'm also going to mark a few areas where we're going to work on the starting of cellulite. So I can see where the cellulite is starting to dimple in. And I'm going to work on that area so we don't get cellulite. This part is going to make the shape more rounded. And then I'm going to work on the texture here. But we'll also get some projection out this way, which is what the model told me that she wanted to achieve. So right in there. And again, I can do the markings a little quicker than I normally would because I've already marked her and I've already had our consultation. But usually this portion takes a pretty significant amount of time. And I just like to look from all different angles. Great. Okay, how you feeling? Everything good? Yes. Okay, great. All right, so over here. There we go. Here. So it's amazing what some symmetry can do for our bodies. It really can, even the tiniest little tweak to make our bodies more symmetrical can make such a huge difference. There we go. Okay. All right. Okay. So again, I'm just checking the symmetry. Great. Okay. Excellent. All right. Okay, so now that I have the markings in place, we're going to pause again to allow the model to lay down on the table, and then I'll get started with injecting. So hold on for just a second. We're going to cover the camera again in order to let her get positioned. All right, we can position. I guess it's supposed to be Hi, guys. Thank you so much for bearing with us. So hopefully it's not too shaky. So here we go. We're going to do a little bit of injection now. So we'll start right here. Here we go. Good. How's that? Is that okay? All right, great. So our model is saying she is doing just fine. All right, how are you doing? Okay, great. Awesome. She says she's doing great. So that is wonderful. Okay, excellent. Perfect. And easy as that. And switch. So I am going to work on going to all these little spots, filling them in, and then we'll probably do a second session where we can kind of see the results the first treatment did, and then we'll go and do a second session based on what we're seeing. So for her today, I'm going to do 2 and 2 vials per side. And that's approximate. That's just based on how it's looking. Like I said, she's a little asymmetrical, so we'll adjust accordingly based on how it's looking. So here we go again. Doing okay. All right, guys, so easy as that. So do we have any questions that I can answer? Does anyone have any questions? And if not, I want to thank you for tuning in, and I will just finish this treatment up for her. We're super excited about the results. She's doing great. And go from there. Thank you so much for joining us. Thank you.